So how does the energy system in your body work? Well, the reality is your body's going to function first off the food that you take in. If there's no food, then it typically will go to the body's natural sugar stores, which is glycogen production. And once you've utilized to some degree some of your glycogen, then you'll usually go to fat burn. So the problem with that is most people have what they call insulin resistance. And insulin resistance means basically the baseline amount of insulin in your system is much higher than what it actually should be. And insulin has a secondary role, which is basically it shuts down your body's ability to actually burn fat. And so that's why, again, people sit there and who have insulin resistance, if they haven't eaten for a while, they'll start to feel shaky, they'll get headaches, so they just feel like they don't have the energy. It's because they don't have the energy. Once they've consumed all the sugar, all the carbs, everything else that they've taken in dietarily, the body will release a little bit of the glycogen, but not enough to actually fully drive the body to function properly, because normally the body's going to rely on your body's ability to burn its own fat to provide the extra energy necessary to function. But with the excess insulin production and extra insulin in the system at that moment in time, you prevent that from happening. That's why a lot of people who have diabetes oftentimes have a difficulty with burning fat, because of the fact that their insulin levels are too high on a chronic basis.